Begin now. So welcome to this session entitled Shaping Healthy Futures, the Critical Role of Parents. This session will explore how parents can drive transformative health outcomes for children and youth across the Caribbean. It will build on regional frameworks and tools and spotlight practical strategies to strengthen parent-school health sector parent-school health sector collaboration, promote culturally responsive health literacy, and empower families as agents of prevention, care, and long-term well-being. I'm Kimberly Gittins, an Operations Officer, Social Analyst with the Caribbean Development Bank. And our speaker today, our presenter, is Dr. Horace Cox. So allow me to introduce him. Dr. Cox is a medical doctor and public health specialist who is the Director of Surveillance, Disease Prevention and Control, and the head of vector-borne diseases at the Caribbean Public Health Agency, CARPHA. Dr. Cox offers more than a decade of national, regional, and international technical, senior management, research, and leadership experience. His role requires providing technical guidance in strengthening existing and new initiatives in surveillance, disease prevention and control, as well as on issues of health information, epidemiology principles and methods as applied to areas of public health surveillance, epidemiological assessments, planning, and evaluation. Dr. Cox's interests are in networking closely with medical, public health, academic, and other key stakeholders in applying and evaluating evidence-based approaches for the achievement of measurable gains of health system outcomes. And given all that he does, we see why it is important for him to be here. When we were preparing for this discussion, I said to him that as a mother, not just in my professional role, but as a parent, this kind of a discussion is important for me because we're always having discussions about what are the best choices, what is it that the policymakers and the planners are doing, and how does that translate into our homes and even into our academic institutions where my sons are currently positioned. So we'll start today with Dr. Cox's presentation. We'll open up the floor for some discussions and then we'll wrap up. We will have about 50 minutes of rich exchange, so listen closely to the presentation, have your comments and questions ready, and we are really looking forward to your full engagement. So without further ado, I welcome Dr. Cox to make his presentation.
Thank you very much. Good morning. All right. I must say that I was feeling very confident coming into the room until I started to run into a few of my former teachers, and that can be quite unsettling, right? Because then they'll ask the question, didn't we teach that guy to speak better? But nonetheless, it's a great pleasure to be here and to be able to share with you. And as the esteemed moderator would have highlighted, coming from the health background, it's a certain privilege to be in the setting with educators and to be able to share different contexts. And I hope that this can certainly stimulate discussions that will follow, and we can spend the hour and find that it's engaging and productive at the very end. So as would have been said, I am Horace Cox, and I'm representing the Caribbean Public Health Agency. And before I go into the presentation, I'd just like to thank the organizers and the sponsors of the meeting for allowing CARPHA the opportunity to share. And we hope that you will also be agents that will help to disseminate the message hereafter. So in terms of an outline, it's a very simple presentation. I think of it more as a conversation and something that could stimulate further exchange. So in terms of context, or in terms of presentation outline, I'll first speak to what the context is. If we're talking about shaping a healthier future, what is currently obtaining that makes us want to strive for better? And then, once we can do that, it's important to understand how it fits into some of the global as well as regional commitments that we've made as part of the frameworks that do exist. And correspondingly, for us to speak a bit to what's CARPHA's mandate, because even though we are a CARICOM institution, I'm not sure how many of you coming from a different sector would be able to relate to CARPHA and know what CARPHA is responsible for. And of course, for you to see CARFA as a contributor to change, and also for us to highlight understanding the problem with some of the innovations that we can advance, and where you see parents as playing an important role in terms of collaborating with the formal health sector in terms of trying to drive change. All right, and of course, as we'd be able to appreciate, if we want to drive change, the innovations need to be culturally appropriate, and of course, they need to be in keeping with the 21st century dynamics, so that children can buy into them. And hopefully at the end of it, we can really have some good exchanges. So this first slide is kind of the opportunity to put things into context. And here I wanted to refer to the health systems framework, which you see to the left of the screen. I hope you're not too far away to be able to make it out. But in the health systems framework, it basically speaks to the different functions of the health system and how, in executing those functions, we can deliver services from a public health perspective as well as from a personal perspective, and how those could go to driving the desired outcomes and impact. So if you look to the left of the screen, from a function perspective, it's important that we look at governance of the health system. It's important that we look at resource allocation and financing. And to the very right of the depiction on the left, you'd see that we refer to health improvements. So for example, when you hear persons speak about life expectancy of a country increasing, that's one form of outcome, right? So all that we do, whether we speak about public health services or on a personal level, these things are to ensure that we can effect or achieve better health outcomes. And in achieving better health outcomes, what we try to do also is ensure that we protect the population, because we don't want persons to achieve better outcomes, but at a catastrophic cost. So one of the things we tend to measure a lot is like, are they paying a lot of money out of pocket to achieve a certain service, etc. So I say all that to say that in this exchange, we'll be focusing a bit on the public health component, public health services, which would be in the center, which would be looking at some of the outputs from the health system and in keeping with the health system framework. But even though we refer to the health system framework, the reality is that in the Caribbean, we boast about many things. Coming to Barbados, people speak about the beaches, the lovely water. You look outside the window and you're like, wow, it's amazing. You go to many other islands and it's the same thing. The challenge is, however, that we have a few statistics that we really don't want people to know about. And you must be asking yourself the question, what are these? One is that in the Caribbean, children and youth are marked by dual burden of under and overnutrition. And this is a serious matter. I mean, growing up, I'm from Guyana, and at times in Guyana, you know, people pinch your cheeks at the child and say, wow, look at you, you look so strong. And your parents got you so healthy. And more often than not, that is not the case if you really get down to it. And the statistics are not in our favor. The other thing is that there's a significant increase in physical inactivity. Right? Back in the day, you had a lot of green spaces where people would go and say, okay, I'm going to play some football, going to play some cricket, or whatever the case may be. They were very active. You had to often ask the question, why aren't you in the house? Now it's the reverse. Why aren't you going outside of the house? And that's because people are engaged with so many different things, and we need to change because the landscape is changing. The other thing is that because there's so many pressures that are acting on individuals and the youth in the Caribbean region, we find that mental health challenges are increasing. When we look at the statistics, Guyana, don't let me single out Guyana, but Latin America and the Caribbean, they would have the highest burden of mental health disorders globally. And as I said, we love to say, come to the Caribbean, we have lovely beaches, what have you, but do you know this is the reality? And when you look at homicide rates, etc., it is significant when you look at it relative to the actual population size. Again, a statistic that we don't want to be telling persons about. And the reality is that all of this, most of it, if not all of it, became worse after COVID-19. And at times when we do develop public health policies, there's something called unintended harm, right? So I'll give an example. COVID-19, very early on when we hadn't access to vaccines and what have you in the amounts needed, we advised persons to take the non-pharmaceutical measures, which included staying at home, reducing the level of interaction that you have on a daily basis. And this led to increase in mental health issues. It's documented. And of course, led to increase in physical inactivity. So I just wanted to see how these things, they interplay and can make what we propose to do as education in collaboration with health a particularly difficult task. Now, having said that, it doesn't quite end there. When it comes to interpersonal violence, in the Caribbean, we've had 2 regional symposiums that spoke to crime and violence as a public health issue in 2023 and 2024. And why is this so? Because, unfortunately, again, in the top 20, global top 20 countries, 10 of them are in the Caribbean when it comes to homicide rates. And it's certainly, again, not a statistic that we want to speak to. And we find that violence is something that goes throughout the life course, and often when you flag it back, you see that they were children that were exposed to violent acts early on in childhood. So it's important for us to know these things and to see how we can work together. Notwithstanding this context, I wanted to share with you some of the global and regional commitments that we've made, and we're striving towards to ensure that we can mitigate some of these risks. And one of them would be, you'd be very familiar with it, is Sustainable Development Goals, and for you, more particularly, you'd be interested in the one that pertains to education. But the point that I want to drive here is that they really go hand in hand. If it is that you have, persons who would have been exposed to violent acts, it can affect the way that they assimilate what is shared within the classroom. It can affect their ability to concentrate. If it is that persons go to school hungry, you can appreciate all of these things are complex things. And the reality is that they all interplay. If it is that a child is not healthy, then obviously this will have a toll on the ability to digest all that is being shared. And just to take it to the left of screen, after COVID-19, we were on a trajectory, more or less, not saying that we would have got there by 2030 and keeping with the SDG agenda, but we were on a trajectory that more or less was saying that we were heading in the right direction. But COVID-19 posed a shock, and after the shock, we were trying to show our resilience by recovering and implementing other programs. But the reality is that we've made a dip, and some of the gains we might not be able to recover in time by 2030. So many persons and many sectors are recalibrating, and we need to ensure that we can focus on these things. But that's global. Let's bring it now to the Caribbean. In the Caribbean, Sir George Allen, who was POW WHO director many years back, was one who would have driven what we call the Caribbean Cooperation in Health Initiative since 1984. And in 1986, it was adopted, right? In 2001, there was a declaration in Nassau, Bahamas. Not sure anyone here is from the Bahamas, but the declaration was about the health of the Caribbean is the wealth of the Caribbean. I'm sure many of you heard this in one form or the other, but it basically started there. And that declaration spoke to not only adults, but also children and the importance of ensuring that children are healthy. To the extent that there are 15 mandates within the declaration for those who might be interested in reviewing it. And one of the mandates is that every year, the second Saturday in September, we would commemorate was Caribbean Wellness Day, and it's a day where we would advocate for physical activity and other things that will help us to drive the right health behaviors and to build awareness. And this year, the theme of it was engage, empower, and elevate. So we spoke to persons about the necessity of a Caribbean plate. I'm not sure many of you heard about the concept, but a balance between what's traditional as well as having the right portions and of course, ensuring that it speaks to wellness. And then in 2007, there was the Port of Spain Declaration that focused on non-communicable diseases. And subsequently, we're in the Caribbean Cooperation in Health Phase 4, which is coming to an end in December, and we are in discussions about transition into Phase 5. The essence of the slide is that many of these frameworks, if not all of them, speak to the need to ensure that we protect the health of the children in the Caribbean and of course the need to engage with schools and the education sector to advance same. So we've spoken to what the problem is. We know that we have statistics that we wouldn't want to speak about. We've spoken to some of the global commitments. We've spoken to some of the regional frameworks. So this time I want to transition a bit to what is the mandate of CARPHA, the Caribbean Public Health Agency. So just to note that the Caribbean Public Health Agency was first put together in 2011 and was operationalized in 2013. And the vision is healthy people, healthy spaces, healthy Caribbean. And it was an amalgamation in 2011, being operationalized in 2013, of 5 regional institutions that are there on screen. I won't go through them in the interest of time. And the mission is to build member states' capacity to prevent disease and promote health and wellness through leadership, partnership, and innovations in public health. So I share that to indicate that we're happy to partner with those in the education sector, because this is the essence of how we reach out and network to ensure that we can have policies delivered to the right people who are in need of them. And of course, recently we would have launched our strategic plan 2025 to 2026, which speaks to stronger together, collaboration, innovation, and sustainable action. So just sharing that there for your benefit. So in terms of what we do, if you reflect on what was shared in slide 1 in terms of the health systems framework and looking at public health services, all these functions are tied to public health services. We promote physical and mental health and wellness. We provide strategic direction in analyzing, defining, and responding to public health priorities. So whether it's COVID-19, Ebola, the threat of Ebola in 2014, impacts recently, whatever it is, we're there. We promote and develop measures for the prevention of disease, and we respond to public health emergencies, and of course support relevant objectives tied to the Caribbean cooperation in health. So just before I go to this slide, the reality is that we appreciate the problem. We know that we have frameworks to guide us as to how we could respond to the problem, and we will continue to brainstorm to ensure that we're innovative in the way that we address the problem. But the reality is that because the landscape is forever changing, we need to keep looking for ways in which we can partner differently, and we can work to work across or break down silos and work across different sectors. And here, in keeping with the title of this presentation, we wanted to speak to the role of parents as health champions and how they can drive change at their level. And many of you may be familiar with the socio-ecological model, which speaks to effecting behavior change by working with different components or facets of society. And part of them would be not only at the individual level, but also at the community level and societal levels. And just wanted to highlight that parents, as you would tell me better that I can say to you, you know, they're important gatekeepers whenever we consider getting to children or engaging with children. And the reality, everybody knows it. This is why the moderator mentioned at the start. Take your right hand, identify your phone, and ensure that it's on silent or mute, because we live in a very complex information environment. And often, even though accessibility has increased, we find that you don't have enough gatekeepers. So all the misinformation and disinformation would be, our children would be engaged with same, and that can be problematic. So it's important to engage with parents as important gatekeepers of health information and behaviors at the level of the home, but also for the school to have the conversation with them, because we do identify that they're primary influences of children's habits and attitudes, and that they're partners in reinforcing school-based learning. You know, and just reflecting on individual experiences, I can say that a lot of time too, the product of a child or the effort that's put in would be based on the level of homeschooling and what the parent puts into that child to complement the formal sector. So just to say that this just to underscore the importance of what the parent does. And of course, care, we say control, which might be a strong word, but managing the environment in which the child is and ensuring that the development of the child is protected. So From the health perspective, we believe that if the parent or parents could be engaged in this way with these things in mind, it can go far way in terms of letting them see the role that they play in bringing about the changes. When we spoke earlier about the desired health outcomes to the right of the health systems framework, we really want the parents to be change agents that can help us to get there in a faster way. So this one will be a bit difficult for you to read. The intention is not for you to read it. I'll speak to it. Yeah, I saw the gentleman take off his spectacles. You won't see better without your spectacles, but I appreciate the effort. But the slides will be shared, and you could relate. But the reality is that this is an example from across the world in South Africa, where they have shown that through engagement with parents, you can invest in the sustainable development of children. And it shows, like, for the different areas of development, how the parent could contribute and how you can break the vicious cycle, understanding the different social determinants of health and how those affect the development of the child. But importantly, I don't have a slide on it here, but I'll just speak to it. Apart from the social determinants, like the socioeconomic level of the household, whether the parents are educated, how far do they live from the school or health services, etc., I wanted to highlight the commercial determinants, which often are forgotten. Just take a second, better said, and think about, in your community, is it easier to get to a fast food place or to a market with fresh produce? Right? I see some people licking the lips. That's not the intention. You're remembering some of the flavors. But the reality, in many communities, it's much easier to get to a fast food place than to a market or a place with fresh produce. And even if you were to get there, at times the price is prohibitive, right? And that is what we call, at times, a commercial determinant of health. So automatically, people make certain decisions that are influenced by the environment. And in health, we refer to it as food deserts. If you can't get to the fresh produce market, or if it isn't in closer proximity to where you are compared to a fast food place. And these are some of the things that influence. So the reality is that we live in a very complex setting, and we need to understand this as we engage with different persons and try to influence the way that, the choices that they make. So I took this from a publication which looks at the parental engagement triangle and the role or the interaction of the student, school, and external support. We spoke about this briefly ago, and I think it really highlights the shared responsibility between families and schools in supporting the students' education. And of course, this is very important when we'll come to health education in a bit and how this can help. So, all of this said, we're engaging. We know we have a problem. We know we have frameworks to guide how we engage. We know that we need to engage with parents because of where they sit and how they influence the decisions that children make. And the reality is that we do appreciate that our interventions need to be culturally responsive. But here's the question. How do we ensure that these things are aligned with the levels of health literacy? Might be difficult to read from the back of the room, but the depiction on the left of screen, it shows that the countries, the darker the color, the more significant the low levels of health literacy would be in those countries. And again, I can't answer for this. It was peer-reviewed and published, so please don't pursue me for the data that is reflected here. But the reality is that, in the Caribbean, as a region, we need to do a lot better in ensuring that the rates of low or the occurrence of low health literacy would be reduced, because it's definitely much higher than we would like. And if it is that there is health illiteracy, the challenge is that people cannot assimilate the information if it isn't really tailored to context. And at times they have difficulty in even choosing the right source of information, much as to be guided by it. So we need to be conscious of this as an important determinant of health in terms of how we prepare messages and get them out to people and engage with them. And we need to recognize that the Caribbean is a very diverse region from a cultural perspective, different languages, And also that at times the power of the message is determined by who's delivering it and what format it is delivered in. And I was reading something which spoke to that the narrative format, or when you do storytelling, it would tend to resonate more because people tend to make an emotional connection to the message, provided that the content aligns. So even as we consider how we engage with parents, we need to consider how we market the message. We know the problem, but it's a question of how we try to speak to some of the gaps that they have and help them to see that in the midst of it all, they're important agents of change and that they need to work with the schools. So these are just some examples. I won't spend much time on this in the interest of time, but these are just some crude examples taken from different places as to how we can work with parents to get them engaged. At the Caribbean Public Health Agency, we have had exchanges with schools or engagements with schools. For example, every year in May, we do commemorate Mosquito Awareness Week. And we have engaged with schools and encouraged schools to participate in the competition. Of course, as they do, we get children to write poems about mosquitoes and the harm that they bring. Because even within the school setting, you have dengue and some of these mosquito-borne diseases that are transmitted. For some persons where malaria might be endemic, that might be a challenge. So you have all these things that could affect children, and they need to be aware. So one way is to ensure that we engage them and engage the parents, so the parents could be educated and that the parents can help to make better choices. So even at times too, identifying the gaps with health literacy, we need to work with parents to ensure that we can lift the literacy levels and develop programs that are innovative, that can reach parents where they are, considering that they're gatekeepers, and to work with them to be real change agents. But first, we need to ensure that we can empower them. And so one of the things that I wanted to leave with you is the need for us to empower families in prevention and to ensure that we equip parents with the skills. One thing is to ask them, but we need to be very, very realistic in that, do they have the skill sets that are required? And at times, it's a basic sensitization that would be required. So even from the health sectors we engage with education, we need to think about not just the engagement with children, but also how we can work with parents so that they're empowered, that they can be true gatekeepers within the home setting and at the community level. And in so doing, we can manage risks, right? So I'll give another example where I recall in one member state, they do this lymphatic filariasis mass drug administration campaign. And in order for parents to make the right choices, you need to go meet at times with the Parent Teachers Association to educate them. You need to go to the schools. You need to send an information leaflet to the home so that the parents are educated and request the consent. So as we continue to engage them, it's important that we empower them, because the choices that they make, whether it's from a communicable disease perspective or a non-communicable disease perspective, those choices are very important. So often chronic conditions or non-communicable diseases kind of suffer because if someone were to say, I think that there is a new COVID strain. Let me use something that's relatable, that's circulating, right? Somebody chuckled there, they say, not me and COVID again. I had enough in my lifetime. And I agree with you. Even from the medical side, we're saying the same thing. And by the way, just food for thought, even though nobody knows where the next pandemic will be, nor when it will be, the reality is that there's some projections that it might be by 2050, right? I see some people already start to calculate the age. They say, not me and that. But not to scare anyone, but the fact of the matter is that nobody knows when it will be nor what it will be. But different people are speaking to it based on the evidence that they have. But the point I was going to make is that infectious diseases, for this simple reason, tend to resonate more. When you speak about it, people are like, oh, no, I don't want this, because the certainty of the risk is quite clear. And so when it comes to driving actions and engaging with parents, they're much clearer as to the risk, and they tend to take the preventive or recommended actions faster. Chronic diseases, very different. You tell somebody about diabetes. Imagine telling a parent, oh, your child looking a bit too chubby. right? This is a risk for diabetes later on. Do you think that necessarily that will resonate as much? Somehow I don't feel it will. And again, I just use a very crude example. Doesn't always work that way, but just using very crude examples. Or if you were to say your child is very inactive, child might develop diabetes or might, or something to that effect at a later time. Do you think that that might change things necessarily because the communication of the risk is much more difficult, right? You're talking about over a trajectory of many years, decades before something might actually happen. And so we need to be clear of how we do that within the school setting to be able to work with them. All right, and of course for them to understand that the school is working closely with them, but I know many schools, for example, some that I attended, you would have sports days where the parents can come and participate, and there's the integration of physical activity that persons can also participate with the children, and there are many other things that could be done from an innovative perspective. But the point that I want to take home is that we need to work with the parents and ensure that not only are we educating them, but they're part of the practices that we roll out. At CARFA, we do have several resources. For example, we speak to a 6-point policy package, and there's a food and nutrition guideline, and we work in terms of building the literacy of different schools. But one of the things I've appreciated is that we need to engage the schools in a more robust and structured way. And I was thinking that I will be a strong advocate of this. Recently, I was in Anguilla on a mission, and I met with Omolulu School. Not sure there's anyone from Anguilla here, but with the principal there, because the school was successful in a Mosquito Awareness Week competition, and we were delivering some of the prizes. And I made the commitment that having been at this symposium last year, that it's a good opportunity for us to discuss with organizers and with educators how we could have a program. We don't want to be, again, we need to appreciate the curriculum is already tight as it is, but how we could be strategic in introducing things that could be impactful, and to look at those that are evidence-driven and could work in this setting, and to see how we can tailor them to our context or scale them up as the need arises. All right, this was just an example. I will leave this here in the interest of time. But in the end, just a quick call to action that, parents are pivotal in shaping the trajectory of health of the children. We should leverage the regional frameworks and regional bodies. I mentioned CARFA working in this space. We also have other public health actors like PAHO, and you'll have others as well, like CDC, et cetera, with a strong interest in working in member states, even UKHSA, considering that you have some UK overseas territories, that educators are important in terms of sustaining parent-school health partnerships, and without same, there's not much that we can do. And therefore, we need to be very strategic as to how we engage. And I really want to thank the organizers of the symposium, because they keep insisting on inviting health to speak, and I think it's very important. And I think now it's for health, doing some introspection, to take it to another level and come with something to propose and for it to be discussed, and to see how we can work together to at least try to drive meaningful change. All right, and just to end by saying that together we drive the Caribbean toward healthier futures. Thank you.
Thank you, Dr. Cox. I think a very important discussion. And sorry, I'm always looking for patterns. I need to have the psychologist in the room tell me why my brain works that way. We can talk about it afterwards. So we had Dr. Cox with the C, and I have 5 C's that I'm taking away. So you gave us the context, some of which we know, and some we don't always want to look at, but very important to know. You talked as well about the commitments to which we've signed on at the global level, the SDGs. You looked at cooperation, those frameworks for Caribbean cooperation on health and in other areas. We looked as well at the CARFA and CARFA strategic plan, and then critically, the actions that we can take and the call to action for collaboration, parents, education, etc. So there are a number of C's, and I think if we want to take them away, we can bear those at the front of our mind. But I want to just, my prerogative before I open up the floor, to ask if you could tell us a little bit about health literacy. We talk about the high levels of literacy, and that's another subject for debate and discussion. But there was a graphic looking at health literacy. And if we talk to persons about what that is, what that looks like, and the fact that we're not performing in the way we would want to in terms of health literacy, what is the message? What does that capture? What does that communicate? And what do we need to do to ensure that there are improvements in that area?
Yes, thank you very much. That's a good question, and I really mean it, because the answer is a complex one. Because as educators, you'd appreciate to drive literacy, it takes a comprehensive approach. And when it comes to health literacy, we need to not only be able to assess the complex information environment, in other words, what are the sources of information, how is the information coming, how it's packaged, whether it's tailored to the context, what are some of the gaps that the people have, and how would it best resonate, what are the best media for communicating these messages. And so I believe that for us to be able to drive meaningful action, we need to ensure that we can appreciate all these things and the nuances that each would bring. And it means that we need to combine operational research with different opportunities where we can feel out what are the main contributors to the health illiteracy that would exist, and of course be able to have targeted interventions that can drive same. The reality is that as we consider working on social determinants of health, and that is one, there's something that we tend to say in public health, which is that you need to be very intentional and very deliberate with your action. We summarize it by saying it's just that you need to be very strategic. And for that, we need to be well informed. So we need to know what resonates with different groups. And often in health, we tend to simplify it, where persons feel that, okay, there is going to be a surge in dengue, so we're just going to do these health promotion material or these pamphlets, and we'll just share them out, right? And at times it doesn't quite resonate because we might be saying that persons don't understand the message, but it could be the media that we're using and not quite the appropriate media. For example, children might be better engaged with social media. Persons who might be of an older group or the other side of the spectrum, they might prefer the more traditional means of engagement. So different things would resonate depending on the different groups, and also we need to consider the educational level and how we can really break it down. So it's not as easy as it seems. It is a complex answer, but certainly it's something that could be addressed, applying operational research and looking at the gaps that exist and being very intentional and deliberate with the strategies that we roll out.
Yeah, your point about really making sure that messages are culturally relevant as well, the way they're communicated, the channels, media, absolutely important. So we're going to open up the floor to take a few questions, and because we've talked a lot about inactivity, I'm going to move around so that I get a few steps in. And so we've got the mic. If you take the mic, introduce yourself very quickly, and let's try to keep our questions very pithy because I think we've got about 15 minutes before we wrap up. Yeah. Okay. We can share.
Good morning, Ashley from Cayman Islands, sorry. Thanks for your presentation, it's very informative. I know that some of the things that popped into mind was about stigma and breaking the stigma in the discussions. It's very much for PTAs, I would say we have a high role in how we present it to our parents and how we have these open discussions and forums. Some that stuck out to me was childhood obesity, inactivity, the diabetes, getting children tested and stuff like that. But one of the major ones that I know that a lot of our countries are struggling with is the mental health aspect of it. And if you could probably speak a little bit in terms of how health is related to mental health, and just expand a little bit more on how we as PTAs can break the stigma on having these open discussions.
Okay.
Thank you, Ashley. Dr. Cox, perhaps we can take 2 other questions or interventions and come back. So we'll come here I'll share my mic, and then if you could follow so that we have all of those key questions coming through.
I have Jillian O'Garo, representative PT of St. Vincent Girls High School. A question to you. You spoke about the desert food desert. The CAFA, would you have any influence in terms of zoning areas where particular foods cannot be sold, or even when we look at persons are attracted, if you don't see it, you won't want it. Serving snacks, would you have a specific or recommendation of what types of snacks should be served to the children?
Thank you. So the first question was on the physical health, mental health nexus, the other one on food deserts and CARFA's role in zoning and really setting the framework for action in that regard. So we'll just take all of the questions. We'll end at the last person standing, and then we'll come to you, Dr. Cox.
So I was actually going to make a comment. I noticed one of the proposed strategies was to have schools help to facilitate parent engagement in health. My background, Sophia Edwards Gabriel, former health and family life curriculum specialist in St. Lucia, and I've also supported projects from CAFA. One of the things I've noticed, though, is that parents may be on the right track. For example, one of the programs we implemented was reducing childhood obesity. And part of that program was where we had parent engagement, education, and move to action in terms of healthy packages. However, with that knowledge and training happening, when the children go into the schools, I don't know if it's the case for all territories, but a lot of our schools in St. Lucia, that is not sustained at the school level. And so sometimes we have to look at it in the reverse order of how do we empower, educate school systems, teachers and principals, so that they can be the drivers of health in children as well. I lecture health and family life also at our community college at the teachers division, and I usually find it interesting that when we do simple things, you spoke about health literacy, for example, being able to read and interpret food labels, being able to understand our food groups and basic difference between nutrients and food groups and all of these things, our teachers don't have. Lots of our teachers do not have that knowledge. And even with knowledge, we know that knowledge alone does not change behavior. So we need to be able to strengthen the knowledge base, but we also need to be able to strengthen attitudes towards change within the school system that will support the parents. Thanks.
Sure, thank you. Good afternoon, Walter Stewart, Trinidad and Tobago. We were involved, the National PT in Trinidad and Tobago, in a project with UWE St. Augustine, IAEA project, dealing specifically with isotope techniques for obesity in our children. And it was recommended that this be introduced in our schools in Latin America and the Caribbean. Do you have any input or further input with regards to that particular project that is being explored now in Trinidad and being introduced through our Ministry of Education to several of our schools, primary schools in particular, in Trinidad, as a means of helping to assist our parents in dealing with obese children and some of the recommendations that they can use if and when they do have obese children?
Sorry, did you say isotope?
Yeah, it's an isotope technology that is being used, yes.
Okay.
Right, good day all. Daniel from Grenada. Now you identified 3 threats, key threats, and I want to focus on one. It says suicide with significant gender disparities. Now in my lifetime as a teacher, I would have witnessed 2 suicidal deaths at my school, had to intervene on numerous occasions with students cutting themselves. Now, from CAFA's perspective, how can PTAs be more actively involved in identifying warning signs, right, of mental health struggles, and what practical steps can we take to collaborate with schools as well as the healthcare professionals in preventing such tragedies?
Okay. Yeah.
Sorry, what am I doing with the mic?
All right. I thought children had the most difficult questions, but the teachers do. All right. So I must say, even though, yeah, very, very good questions. I appreciate same. Okay, so the first one, which came from Cayman Islands, was about the link between physical and mental health, and then also looking at how to address the stigma and discrimination that might be associated with same. So there is one that I'd like to start firstly by stating that when we look at the definition of what health is, we speak about physical, social, mental. The reason is that often persons tend to separate how you look at it, and that's problematic. The way I feel if I gain 10 pounds and I can't fit into my jeans, it can have a toll. I could be depressed, right? And we have different persons with different levels of resilience, right? If something very simple, you have a child who might be overweight, is at school, and is often teased by children. That child could be depressed. I mean, you have some children who are very resilient, might not affect them. But for some of them, it takes a toll. And they may be subject to bullying and other forms of violence in uplifted commas. So the point that I'd like to reiterate is that they go hand in hand. Also, you find that as we look at how we can address and break the stigma and discrimination, I think it's about building awareness, sharing information that we need to be inclusive, that everyone is different, that we need to respect individuality. I think that can go a far way, but of course, as I shared earlier, there are other things that influence perspectives, and you know this very well. When a child comes into the classroom, there was a whole upbringing in the household that you now have to deal with as an educator, right? So you might be trying to address it, and you could share information, but their cultural beliefs, there are many other things that would influence, and therefore, we need to be realistic in that even at the school setting, as you work to sensitize the other children and bring some awareness, you might not be able to address the problem in its entirety. But of course, you don't expect this to be widespread. And so my encouragement is that the way to do it would be to build more awareness and teach the right values, and all that is already embedded into the school curriculum, and ensure that people understand that it's an inclusive environment and that this is not an ideal behavior in society. I think that can certainly go a far way.
Dr. Cox, I think when we started, the whole idea of conversation was put on the table. So this is a conversation, so I'm jumping in.
Sure.
So you've talked about the fact that the school system is set up already with a lot of this information being shared. But because there are many parents in here and many parents who will listen to the recording, it's in the schools. But what if it isn't being delivered? What can parents do where they reside, in the communities, in the homes, or to even support what is already embedded in the school curriculum?
Yeah, okay, so thanks for that. And as you said, it's conversational and dynamic, so please, I appreciate that. So I think also we can use opportunities, for example, at the PTA sessions, if we sense that this is a particular issue, the school could be strategic in terms of a constant engagement and having it feature something that is relevant. Also, I think to bring about change at the community level, I think it will require a cross-sectoral approach, because it won't just be for education to address it. Education is approaching it from the perspective of the child, but there are other dynamics that would need to be considered. And thankfully, I mean, I'll make note of this, but as I mentioned, we've had 2 regional symposiums at heads of government level looking at violence as a public health issue. And so we will factor this in as to how to engage with schools to address some of these things, considering that you already have the content embedded in the curriculum, but it's not necessarily driving the change, right? And there is where it gets very complex, because when we're talking about driving behavior change, it's a difficult thing to disentangle. This is why you have behavioral scientists. And even in health, when we wish to encourage persons to adopt the right practices or health practices, you know, the whole behavioral change component could be very complex. So just to say, it's not as easy as it seems, and for those who might be experiencing it, do not give up. It requires a more strategic approach, but perhaps we should also create a channel where there could be this feedback mechanism as to how it's happening, it could be tracked, etc. But I think there really requires a cross-sectoral approach that goes beyond the school, excuse me, but the school has an important role to play. And just to reiterate the point that in the Caribbean region, we are addressing this at the moment in terms of looking at strategies that could address violence as a public health issue. And of course, bullyism would be one form of it, because there's this psychological trauma that results from all the teasing and all the isolation that may result. Yeah? St. Vincent and the Grenadines, forgive me, I'll just refer to the country. I didn't catch all the names. Yes. You did ask a question about the food deserts and whether there's any zoning that could be done, and for example, what's the role of CARF in doing this? This is very complex. I read in the literature about attempts that were made to address some of these commercial determinants of health, not just related to food deserts, but you can have lawsuits that can result, because these are powerful companies, right? And at times, even if your law supports it, the evidence is there to show that at times they get an international law to take you to court, right? So just wanted to identify that it's not as simple as it seems, but a lot of it comes down to local policies. For example, I know of a policy in Barbados where with the sugary beverages, etc., there's a tax, and that tax goes back to public health measures. So there are things that could be done that can help to address it. Certainly within the school setting, I'm not sure how access is in terms of who can go and who can sell within the setting, but I imagine that the school would have some important part to play in terms of determining that, but certainly it could be decided there. And from CARF's end, we certainly could provide these recommendations, and we do have some available as to what should be made available in schools. But it's really powerful. And one that I never understood that I experienced elsewhere, I know time is going quickly, is sometimes, and again, just being transparent, we all might try fast food every now and again. But in some places, when you say, no, I don't wish this soda, I prefer water, you have to pay more money. Right? In some places. So just imagine that. So actually you're hit harder by trying to make a healthier choice. Right? So just wanted to leave it there. But we can certainly, we have some material and we can certainly make those more available to the group.
So we're going to get our exercise in because we're sprinting towards the
Yeah,
wrap-up.
we're sprinting towards the end.
We've
Yes,
got 2
yes,
minutes
yes.
to go.
I appreciate that. So St. Lucia has a question about how do we empower teachers and principals, and the question about food labels, St. Lucia. Where was it? No, she said she worked in St. Lucia. So I believe that what we need is an empowerment plan. And this could be done at community level, but this is really a health empowerment plan. And of course, you'll have different actors, including the school that can participate, and or a community empowerment plan, we can call it differently, considering this cross-cutting. And we can ensure that all these things are reflected. We are in many discussions at the regional level about the right approach to flag when something is high in fats, high in carbohydrates, or high in sugar, or high in sodium, right? Many are proponents of the traffic light approach, which has been used in other places. Many are in favor of just saying what it is, but the reality is that there is no uniform recommendation as it is, no standardized approach to this. So we are in discussions about it. We think it's very important, and where we want to end on this is that we just need it to be relatable to the people, that they can just glance at what they're buying, the parents, and know that, okay, I'm making an informed choice based on what I'm seeing, and that it would be simple to pick up. But the simple answer is an empowerment plan. Trinidad and Tobago did ask about the isotope techniques, and to be honest, I don't know of this initiative, but I'd be happy to learn of it. I mean, CARFA's headquarters, we're based in Trinidad and Tobago, so I'd be happy to learn of this and perhaps engage more closely with you on it and see where we go from there. And then lastly, Grenada asked about mental health, and which was mental health and suicide in children. Could you remind me the question? I made a half note, sorry. Yeah. Yeah. Yeah, so the reality is that it's about empowering the school. Of course, teachers are there with a specific purpose, but they're important gatekeepers and they spend a lot of time with the child and could identify, I know you spoke about like persons having slits on the wrist and what have you, and certain behaviors. So once that is identified as a gap within the community, a program could be delivered or tailored to the teacher's context. The teachers are empowered to identify what might be warning signals or high-risk behavior. But of course, the idea would be to integrate those persons as far as practical, engaging with the parents as well, into the formal system, into the health system, where you have professionals who are prepared to deal with it on a daily basis. And just to note that it's also part of the psychological support is an important part of it. So hopefully as we continue these discussions at the regional level regarding the policies to address crime and violence as a public health issue, we can come up with things that also would be relatable to the school. So again, thanks for the opportunity to participate in this. I'll take these back, and thankfully I am positioned to advocate and to push these as part of the policy agenda. Of course, they're subject to a review process, but I believe that the school plays an important part, and I appreciate all the feedback, and I've taken note. Thank you.
Thank you, Dr. Cox, for, I think, an excellent and engaging session on shaping healthy futures, the critical role of parents. Certainly as a parent myself, there's a lot that I can take away, and rest assured that I know now I have your contact details. You're a call or an email away, and I will certainly be following up with you, but I know that those in the audience really have had a lot on which they can continue to think and to make critical changes where they reside as parents first and foremost, because that was the focus of the conversation, but as educators and actors in other spaces as well. So thanks everyone. I believe it's up next is our break, and then we proceed on our study tour. So thank you for joining us.